Good morning, everybody, and welcome to our webinar on the Iron Curtain of Vaccination in the EU. Welcome to our event, and for the beginning, I would like to show you a very short video, 12 seconds, historical seconds.
Mr. Gorbachev, tear down this wall. Mr. Gorbachev, tear down this wall.
And the Berlin Wall fall, as you know, more than 30 years ago. And but some of the realities, some of the inequalities still persist at the EU level. And I think the vaccination is one of them. And this is the reason why we choose to discuss today with you all about this Iron Curtain of Vaccination in Europe, about the barriers and opportunities for tackling East-West inequalities. My name is Marius Janta. I'm the founder of the Center for Innovation in Medicine, who is one of the organizers of this webinar together with the Eastern European Vaccination Task Force, EVAX, and I will refer a bit later to this. A disclosure at the beginning of this event. This is 100% independent event. We don't have partners from the industry, but all of them are welcome to join our conversation. On the other side, we know that this topic of pandemic and especially the vaccination currently is not mainstream anymore, is not of interest for, let's say, mainstream media or society and so on. But there are some lessons learned during the pandemic and during the first wave of vaccination campaign that I think we should be able to understand, to highlight them, and to inform future vaccination campaign. In order to start, I will show a few slides. As I mentioned, I'm the founder of the Center for Innovation in Medicine. We are a civil society organization with a very strong focus on innovation in healthcare. And the idea, our idea to all these type of activities, from communication to education to policy, from policy to research, is to shorten the time from the occurrence of an innovation and the time an innovation reach a patient or a citizen. And in the context of the pandemic was about and still is about innovation. A lot of innovation came, and our role, at least in the communication with the general public, was a very important one. Probably I have been involved in more than 1,000 interviews in the first 2 years of the pandemics, most of them related to the new technologies used for the vaccination and in general to promote vaccination. In the context of the war in Ukraine, we launched our international platform, Rethink Health, on the idea to build forward better. And this Eastern European Task Force on Vaccination is the first initiative, the first attempt to put together a group of interest around a topic, a certain topic, put together these groups of interest from our region and to try to find a common language and to try to address issues like this on the table today, the issue of inequalities, the issue of Iron Curtain when it comes to COVID-19 vaccination. I mentioned that the pandemic was about innovation and is still about innovation. We all know that in only 30 days, 1 month, the complete sequencing of the virus was done. And this very, very fast characterization of this SARS-CoV-2 was the starting point for the fast development of high quality test, and as well for the start of the development of the vaccines. We are now in the era of vaccinology driven mainly by messenger RNA, who provide us a lot of precision when we discuss about vaccinology. Coming a little bit back to the role of the genomics in the pandemic, of course, genomic surveillance provide us a chance to identify other variants of the virus and to understand what potential new variants could arise. Of course, the genomic and clinical information will hopefully help us stratify the risk for severe diseases in order to have more targeted vaccination campaigns in the years to come against COVID-19. I think the definition of vulnerable population referring to people with comorbidities and older people, it's incomplete. And we, in this era of omics and in big data era, we should be able to have a more precise approach when we discuss about the high-risk individuals. So I think we are slightly moving into a new era of precision vaccinology and precision public health with more precise interventions. And all come after the developments we have seen in the 2 years of the pandemic. We have been very happy in December 2020, and some of us surprised to see that European Medicine Agency provide the opinion and approval, conditional approval for in December for 2 messenger RNA vaccines after only less than less than 1 year, around 10 months after the start of the studies. A real record who was possible on one side because the science helped us, and I have highlighted some of the scientific developments like genomics and the use of messenger RNA platform for this, and on the other side, the collaboration between the industry and regulators that made possible this very fast assessment and a very fast decision of the regulator to approve the drugs, to approve the vaccines in this case. So we know from previous experiences with other types of vaccines that might took around 15 years or longer to develop a vaccine. And as I mentioned, for the SARS-CoV-2 vaccine development, 10 months were enough. And we all remember the EU vaccination days, 27, 28, 29th of December 2020, with the vaccination campaign starting in the same day in all the European EU countries, and was the Christmas. And I remember that I have been in a holiday at my parents, but I have to ask questions coming from the reporters, probably around 4 to 6, 7 interviews per day, despite the fact that was the Christmas day. So was a very big interest from the media as well from the citizens on this vaccine. So we're all very happy with this, and we were very happy to see the European Commission involvement in negotiating the contracts on behalf of all the EU member states. And now we have we just seen in the Lancet this week data showing that 20 million deaths were prevented by the COVID-19 vaccination worldwide. So the numbers are so big that simply I have nothing else to add on this. The value of these highly innovative products is very clear. 20 million deaths avoided worldwide by the use of COVID-19 vaccination. But if we are looking to the European map, you can see what we put actually in the title of our webinar. We can see this inequality between Western countries with a very high rate of vaccination, up to 90% or even more in some countries, and going to 20%, 30%, 40% in our region, 60% in Hungary, and we'll try to identify the reasons with Victor later on. So this graph, I think, it's very important to have on the back of our minds when we discuss about the access to vaccination, and to understand the reasons behind the hesitancy or refusal to use the COVID-19 vaccine in at least so far. But another image actually shows the same reality. If we are looking to the HPV vaccination programs in countries in Europe, we can easily see quite the same Iron Curtain of vaccination. And this is very important, and we have some numbers showing that there are huge inequalities between the Eastern Europe, no matter, in fact, the year is 2019, is 2020, is the first dose, is the final dose, is for the males, is for the girls, doesn't matter. You can see the differences between our region and other European regions. The point is that I've discussed a lot about innovation, about the biology, and we know from public health courses in the medical university that the determinants of health are diverse, and we should look beyond the genetic and biological factors who count for 22%. We should look beyond the medical system that it's important for 11% of the chart. I may say that from the logistic point of view, the organization, at least in Romania, of the vaccination campaign was very well done. So, but despite all this very good logistic organization, timely access to the vaccines, actually we see this reality, this gap between our region and other regions in Europe, and probably we can find some explanations if we are looking to the social circumstances and to the individual behavior, and we'll do it later today in the panel discussion. For us, trying to understand what is happening, is clear that at the individual level, we can discuss about the citizen metrics. with the micro level, our beliefs, our attitudes, our perception, our behavior that can be influenced by the meso levels. And this was very important in community, small communities, small towns, small villages, where the role of the mayor or priest or educator was very high, a very important role in the vaccination campaign. And the macro level with all the social media and traditional media approaches, including the infodemia, a very important role on this, and as well disinformation and fake news. Of course, we imagine the way to tackle all these levels and challenges in a direct way, in an indirect way, with different types of influencers, with different types of messages. But the key is that we should be able to identify the right message for the right citizen from the right source at the right time. So this could be the definition of personalized communication model that can be used as well in order to improve the vaccination. So I think this is my last slide, showing that some of the lessons coming from the COVID-19 pandemics are important for the ongoing public health emergencies, like the infections with the monkeypox and this monkeypox virus. And this editorial from the Guardian saying that says that language has a vital part to play in virus control, and the WHO should monitor the language as well as case numbers. So it's about the, let's say, traditional public health, counting the case numbers, but as well having in mind always the messages in terms of quantity and quality. And this is, I think, a lesson, a very important lesson coming from the pandemic and the experience with the vaccination campaign. And I will start by saying, dear all, let's please tear down this Iron Curtain of Vaccination. We are all together today, representatives from the European Commission, from other European organizations, but as well from the countries from the region, to try to have a very open discussion, trying to identify what is the best way to move forward with the vaccination for COVID and with the vaccination in general. And I just showed the data on HPV vaccination, knowing that next year we'll start the first round of HPV vaccination, part of the European Beating Cancer Plan. So I'll stop here, and it's my pleasure to invite now our first speaker, who is Professor Diana Păun. He's presidential advisor at the Department of Public Health at the Romanian presidency. So thank you so much for being with us today, and the floor is yours.
Thank you very much, Marius. I just want to ask the organizers to permit me to have also the video, because I'm stopped by the organizer.
Yes, we'll try to manage this.
Anyway, till now, dear organizers, esteemed guests, good morning. And thank you for the invitation to join this critical and timely dialogue on barriers and opportunities for tackling, okay, now, okay. For tackling East-West inequalities on vaccination in Europe. First of all, as we all know, the COVID-19 pandemic that many of us perceive as a shattering living experience has once more put the invisible East-West divide into a stark spotlight. Eastern European Union countries lag far behind their Western Bloc counterparts in vaccination against COVID-19. But this is not a division COVID-19 has created. However, a reality that goes beyond the pandemic and the COVID-19 vaccination campaign, and looks at the perspective with which the population looks at routine immunization. The reluctance to take vaccines, true, is not an easy subject to deal with. And that is why it was listed as one of the top threats to global health by the World Health Organization. And there is a range of factors, from fears about vaccines and their possible side effects, to doctors' hesitance to back vaccination, to the distrust deep-rooted in the collective mentality that might be a result of exposure to the communist regime. And of course, there were the fake news. But I think that the difficult situation we are experiencing during this period could have been avoided or greatly diminished if we had invested more in health education. The fundamental principle in public health has somehow been set aside as a low priority. Prevention should be the cardinal principle for any health intervention. So investing in developing the basic capacities of the public health component at the national level is fundamental. A sustainable health security architecture must be at the heart of a sustainable heart prevention and education policy. This is not an area where results are expected overnight. Health literacy is a process that requires time and sustained investment in all areas, because health is in all policies and all areas are impacted at the same time impact health. At the same time, a health education program needs to be based on an exploratory approach to understanding the perspective of communities and individuals, so that we can ensure better health outcomes. And at the same time, I call on joint political, social, and media efforts to counter attempts against vaccination that exploit the pandemic to create fear of polarization in societies, and in time when unity, cohesion, and solidarity are strongly needed. Thank you again for the invitation, and congratulations for this important event. I'll be here and I'm ready for discussions and debates. Thank you very much, Marius.
Thank you so much for your speech, as well for your involvement actually from the very beginning in the pandemic and then in the vaccination campaign in Romania. Very strong support from your side and from our president, of course, for this topic. You mentioned the post-communist past. This, for our guests that are living in Western countries, might sound curious, you know, after 30 years. But we have seen some data not related to the vaccination, but related to the deaths due to COVID, showing that except Peru, the other top 10 countries with the highest mortality related to COVID are post-communist countries. So this is a reality, and this is in relation with the idea of the trust we'll discuss a bit later, the trust in general of the society level between us as citizens, as people living here, as well the trust in the institutions. Actually, no matter who is in charge of conducting an institution, is the idea that we cannot trust a certain institution. We don't have to mention one. And of course, the role of health literacy. And I know that from the very beginning, you advocate for the role of education for health as one of the priorities of our president. And what is, I think, very important is to take into consideration this idea of lifelong education for health, because things are changing. It's good to start educating children. It's good to start having programs in the schools and universities, but I say this as a parent, we should educate as well the parents, especially when it comes to these hard to understand concepts like messenger RNA or genomics. So thank you so much again, and as well for putting this idea of tackling the community, not just the individuals, in order to understand the reasons behind the hesitancy and the reluctance, and as powerful tools to activate the vaccination. So thank you so much once again. And now we are moving from, let's say, regional or national perspective to the European Commission. We are very happy to have with us Martin Ingvorsen, who is policy officer at DG Sante, Public Health and Security Department. Martin will discuss about the current status of COVID-19 vaccination in Europe and the proposed mitigation measures. So Martin, the floor is yours.
Thank you very much for the floor. I'm trying to put on my video, and I would also like to ask you if you can hear me.
We can hear you. We cannot see you yet, but we can hear you.
I think you can see me now.
Yeah.
Okay. Good morning, and good morning to all, and thank you very much for the invitation and for having me today. My name is Martine Ingvorsen. I work as a so-called policy officer in DG Santé Health Security in the European Commission. I am going to speak today, as was just said, about the COVID-19 vaccination in Europe. And what I am going to give you is a pretty neutral picture of the state of play and how we imagine in the Commission the way forward from here. If I could have the next slide, please. I would like to read aloud here a quote from our President Ursula von der Leyen from her State of the Union Address 2021. As you know, it comes a little bit from the US, but every year our President Ursula von der Leyen makes a so-called State of the Union Address. And in 2021, she said as follows: "When I stood in front of you 12 months ago, I did not know when or even if we would have a safe and effective vaccine against COVID-19. But today, and against all critics, Europe is among the world leaders. More than 70% of adults in the EU are fully vaccinated. We were the only ones to share half of our vaccine production with the rest of the world." In a way, this tells it all. I mean, we've been through 2 or more than 2 years of the pandemic of SARS-CoV-2, and in the beginning, all we could do was really to try to limit the spread of the disease. But then, when we put all our powers together, so to speak, we actually managed to develop a vaccine in less than a year, and this is what Ursula von der Leyen is telling here. So that's a little bit a miracle of science that in this 1 year only, we actually, or Europe actually, managed to develop a vaccine, and we also started rolling it out. So if I could have the next slide, please. So, I mean, all this happened due to the EU strategy for COVID-19 vaccines, which provided access to vaccines for all member states, big and small, at the same time and on the same conditions as soon as they became available. And on the 31st of August last year, we reached an important milestone, as 70% of the adult vaccinated population, in the European Union had back then received a full primary vaccination course. And when I speak of a primary vaccination course, I mean 2 doses. And then after this, vaccination coverage rates have further increased, and currently more than 80% of the adults in the European Union are fully vaccinated. Next slide, please. The problem is that there is still a significant proportion of unvaccinated or not fully vaccinated individuals in the European Union. And vaccination coverage rates are also very different across member states. And we can see this when we look at the COVID-19 vaccine tracker. This is a tool that was developed by the European Centre for Disease Prevention and Control. That's the scientific agency, which is based in Stockholm, that you of course know. It's a tool developed by them to follow the state of play of COVID-19 vaccination in Europe. And now, for instance, here, this is the situation. I took it from the tracker 2 days ago. And in the left side of the slide, you can see the uptake of a full primary vaccination course in the total population EU member states. What you can see here is a map with color coding. And as you can see, the more green it gets, the higher the uptake of COVID-19 vaccination. On the right side of the slide, you have the same figures, but now in a chart with percentages. And you can see that there are quite big differences between member states. If I could just have the next slide, please. I also wanted to show you here, just from my own country, Denmark, that the tracker also allows to go into details for individual member states. And here from Denmark, you can see that around 83% of the population have received at least one dose. Around 82% have received a full first vaccination course, and around 62% have also received a booster dose. So this is really a tool that can help us follow the vaccination course, so to speak, the uptake of COVID-19 vaccination in Europe. But of course, it depends on the data that is reported to us by member states, because data is super important. We cannot do these things without data. And this is why it's so important that countries report to ECDC. Next slides, please. I mean, the difference in vaccination coverage rates within and between member states, that's a challenge that we need to rise to. There's no doubt about that. It's summer now. We can enjoy the nice weather and everything, but there's a new autumn and winter coming up, and we need to be prepared for that. And on the 27th of April, last April 2022, the Commission published a communication with the title COVID-19, Sustaining EU Preparedness and Response, looking ahead. This is an important publication. It takes stock of the COVID-19 vaccination as it has been so far and as it looks now. And it also points out the way forward from here, not only in terms of vaccination, but also in terms of vaccination. And in terms of vaccination, there are some key messages in this communication. The key messages are that the COVID-19 pandemic has become more manageable, meaning in particular that what we see now is a decoupling of the number of severe outcomes from the number of cases. For instance, we can see that we still have quite a lot of cases, or cases may even be on the rise, but we do no longer have the same number of hospitalizations and death. So in this sense, the COVID-19 pandemic has become more manageable. But it's very important also in terms of communication to the public to say that the pandemic is not over. And in terms of vaccination, the challenges remain. because there is low uptake of vaccination in some EU member states, and there are these differences in vaccination uptake between EU member states. So the priority, from here, that is to close the vaccination gaps within and between EU member states, and this needs to include, these efforts need to include that we address vaccine hesitancy. Next slide, please. And then how do we do this? This is complicated, as was also said in the previous presentations. What needs to be understood here is that vaccination is a national competence. Everything that has to do with public health is basically national competence. That also means that vaccination programs, policies, and services is something that member states organize themselves, and that the Commission plays a supportive and coordinating role. The Commission has no decision-making powers in this field. However, the Commission works with all EU member states in our Health Security Committee to support countries in increasing the uptake of vaccination. And the European Centre for Disease Prevention and Control provides country-specific support to EU member states with low uptake of vaccination. They have, for instance, provided webinars for health professionals in national languages. I'll come back to the topic of health professionals in a moment. So if I could have the next slide, please. Yes, actually it's here, sorry. Because this is what's important here, or it's one of the important topics, is that we team up with health professionals to address vaccine hesitancy, because we know from various surveys at EU level that health professionals are trusted sources in terms of information about vaccination. They are the ones that citizens and patients turn to when they have questions or doubts about vaccination. Health professionals can also serve as role models, getting vaccinated themselves. And now I need to say that it's no secret that some health professionals can also be hesitant towards vaccination. So this is also something that we need to work on. In terms of what the Commission is doing with health professionals, we have a so-called coalition for vaccination. It's a coalition, it's the first one at European level. It consists of European health professionals and student associations, meaning umbrella associations who have then like national associations under them. And this coalition has its own website that you can see below on the slide. And they have actually helped us already address low uptake of vaccination in some member states. They have also helped us reach out to health professionals at national level, so that we can actually have a dialogue with them. This is what we believe in, and the work that we're doing with the Coalition for Vaccination, it's our way of working with health professionals, because we know that they are trusted sources. Next slide, please. I would also like to say that this is not something that I know so much about, but I guess that because I'm not working directly on this, but you all know that the COVID-19 pandemic has given rise to an infodemic as well, with a lot of information out of there, a lot of false information, also a lot of accurate information, but indeed also a lot of narratives, conspiracy theories, and such things. And it can be very difficult for citizens to navigate in this. What the Commission does is that, together with ECDC that I just mentioned, but also together with the European Medicines Agency, we provide access to accurate information on vaccination. We have, for instance, the European Vaccination Information Portal. You can find the link here. This is an independent web page where citizens can find accurate, authoritative information on vaccination, not only COVID-19 vaccination, but also COVID-19 vaccination. And I would like to say that now this portal also has content in Ukrainian due to the Russian aggression on Ukraine. The Commission also makes efforts to fight mis and disinformation on vaccination and vaccines. This is not really my department working on this, it's more our DG Com. And they do this in various ways. They do social media listening, for instance, to kind of follow what is out there in terms of narratives, but they also work with online platforms to be sure that these platforms in their algorithms prioritize accurate information and not so-called fake content. Next slide, please. I would also like to say, because now we're speaking a lot about COVID-19 vaccination, and it was also mentioned in one of it was alluded to in one of the previous presentations that COVID-19 vaccination is not the only vaccination or vaccine that's important, of course. And the Commission has been working on vaccination for many years. The current legal basis for our work is currently the Council recommendation on strengthened cooperation against vaccine preventable diseases from 2018. So you can see it's a pre-COVID-19 initiative. This is a policy initiative that calls for a lot of various actions with the one goal of increasing vaccination uptake in Europe. Back then, we developed a roadmap for the implementation of those actions. This roadmap is publicly available, and you can see the link below. Actually, all the actions in this Council recommendation is set to end or to be finalized end of 2022. We are almost there. We are on track despite of COVID-19. So then, of course, the question is, what will we do next? And our next stop is actually the EU for Health program. Which is a very ambitious and expensive health program that goes from 2021 to 2027. So it's a 7-year program, and this program also includes actions on vaccination. For instance, we have launched a call for tenders on physical obstacles to vaccination. This is something that I am personally very interested in, because I mean, not getting vaccinated is not only about hesitancy, like an individual perception of vaccination. It has also to do whether it's convenient, whether the access is easy, whether I can have time off from work, all these things to actually get vaccinated and have my children vaccinated. So we would like to know how much such structural barriers actually impact the decision of getting vaccinated or not getting vaccinated. We also have another call for tender, which is about the European night tax. That's the national the night tax. They are technical working groups in the countries who work on vaccination. We would like to strengthen that cooperation further. And then we also have a call for tenders on methodologies for monitoring the performance of vaccination programs. So this is basically our next step, and we of course in all our work try to take into account the experience that we now have from the COVID-19 pandemic. I would also like to say now that the topic of HPV vaccination was mentioned. It's not on the slides, but we're also preparing a council recommendation on vaccine preventable cancers. And that's a council recommendation that will be made in the framework of the cancer plan. Also to work on HPV vaccination in Europe for both genders, both boys and girls. So this is where we are now. This is a little bit a snapshot of the situation. And all this is, of course, work in progress. I think I have one last slide on where it just asks whether I have you have questions. I mean, I would like to say that I will not be able to stay for the whole meeting. So in case it's possible, I would like to take questions now. Thank you.
Thank you. Thank you so much, Martin, for your presentation. Indeed, you can use the chat to address questions to our panelists today. Thank you so much for many details you share with us today. I think there are a few key messages. The one is the winter will coming up, and we should be prepared for this. And one of the key messages, I think, is the pandemic is not over. And this is an umbrella message that can as well help the promotion of the COVID-19 vaccination. Of course, the European Commission has no power in this area, but we all know the soft power of the European Commission in different areas related to the healthcare. So we really appreciate your presentation and your presence here. So I think we have a question for you, Martin. Thank you very much for the presentation. Related to the Council recommendation on vaccine preventable cancers, you mentioned HPV, but will the recommendation cover also hepatitis B related cancers?
Yes, it will. That's very easy to reply to. It will indeed. I would also like to say, I can see that there's a question for whether the slides can be shared, and yes, you can share the slides so that the audience can have the links. No problem.
Good. Any other questions for Martin? As well, I will highlight your message regarding the role of healthcare professionals, but I think underused so far in many vaccination campaigns, and especially the nurses, not just the medical doctors, but the nurses. We had a lot of messages coming from the nurses organization, as well from the EU level, saying that the nurses should be more engaged with the vaccination campaign. And thank you as well for discussing about the EU for Health program, a very ambitious one with a different mechanism, tenders or calls and so on. And it's very good to see that COVID-19 vaccination is part of the agenda of the EU for Health. So if there are no other questions for you, Martin, thank you so much again for being with us today. We count on your soft power inside of the European Commission in order to help us all move forward with the vaccination. And now we are moving forward with our agenda. Initially, we considered to have Alfonso for the next presentation, but we will move with Patrick Swain, the coordinator of the Coalition for Life Course Immunization, who will discuss about the gaps in immunization strategies at the EU level. And then I will invite you, Alfonso. It's just a matter of timing. Patrick should disconnect in about 10 minutes. So we made this inversion. So Patrick, thank you so much for joining us. The floor is yours.
Thank you very much. Can you hear me okay?
Yeah.
Lovely. And Alfonso, sorry to jump in like this. Like Martin, I have to jump off the call in around 20 minutes time. Thank you very much for having me. It's great to be on this discussion today. It's a very important topic. Like Marius says, I am the coordinator for the Brussels-based charity, the Coalition for Life Course Immunization. We're a European network of different associations, academics, NGOs and policy experts who are all keen to make the case to policymakers and peers alike about the importance of life course immunization and the need to vaccinate against severe disease throughout the life. And today I want just to say we are keen to be a part of this this important program of work, and we are hoping that we are successful with the funding program, and we're very happy to be on the tender. And today I'll be presenting findings from CRCI's latest reports, COVID and Beyond, which we published at the end of April. And yeah, okay, thank you very much. So as you can see on the first slide here, I think Martin has already covered it, but overall, Europe has responded very well to COVID-19 vaccination. Between May and July of 2021, over 40% of European adults received their second dose or the full course, first primary course of the vaccination before the boosters, which to me is a real success. I think Europe and where I'm from in the UK, there was a real good response from people to receive vaccination. But however, as we have been discussing today, when it comes to Eastern Europe, uptake has been significantly lower. Countries like Bulgaria haven't even reached 40% yet in terms of 2 doses. Countries like Romania is just only over 50%. So there's still a long way to go in terms of vaccination in those parts of the European Union, as well as non-EU countries, like we've been discussing, countries like Ukraine and Moldova as well. Could I have the next slide, please? Thank you. And actually, when it comes to other vaccinations, such as flu, it remains very much below the WHO's target of 75%. And while some countries have come close to this, and there has been an increase in uptake in light of the COVID-19 pandemic for other routine immunizations such as influenza, there is still a long way to go in achieving that 75% uptake, that red line on the graph on the right-hand side of the screen there. But countries like Greece and Ireland, from the data in 2020, we can see they've become quite close in people aged 65 and over, but in some other EU and EEA countries like Iceland and Liechtenstein, uptake remains considerably lower in this cohort who are more at risk. Moving on to the next slide, please. And when we're talking about at risk, Europeans with chronic conditions, uptake is even lower. And although around 1 in 4 European adults live with 2 or more chronic conditions, less than half were vaccinated against influenza in 2018, which is quite alarming, because if you have an underlying health condition, at least with influenza, you're 10 times more likely to die, and you're more likely to suffer from the severe disease if you contract flu. So we know vaccination is the best form of prevention, and it's critical that people with underlying health conditions receive their routine immunization. And one of the main reasons that I think, especially in the context of COVID-19, thank you for moving on, one of the main reasons and one of the key strategies that has not been achieved is clear communication on COVID, on vaccination. And I think whilst there has been communication has been ramped up, and whilst people have started to understand what a vaccination is more, misinformation does start to seep in, and disinformation as well. And this can have a real impact on not just COVID-19, but other forms of vaccination as well. And we've heard from the other panelists today about how this can have an impact. And one study that we looked at suggests that, exposure to misinformation can decrease the likelihood of someone getting a COVID-19 vaccination by 6.2%. And that big stat on the screen there, since 2019, so prior to the pandemic, and obviously the COVID-19 pandemic has exacerbated this, the leading 147 anti-vax social media accounts have gained over 10 million followers. So really we can start to see that people who are espousing disinformation and fake news on vaccination are starting to gain more traction, and there needs to be more in this field of communicating the right messages, positive messages about vaccination, its benefits, and why it's important for the individual. Next slide, please. And even more crucially, when we look at funding for immunization programs, that's not just the vaccine itself, but everything that comes in between, things like communication and the rollout of vaccines, all things to do with immunization programs. 77% of EU countries spend less than 0.5% on immunization as a proportion of their healthcare budgets. And a country that does quite well at this is Luxembourg, In 2019, it spent over 2.5% as a proportion of its healthcare budget. And for CLCI, we believe there should be maybe a metric, and there should be a target for all European countries. So yeah, this is really something that we should be considering as well when we're talking about vaccination strategies, ensuring that there's sustainable and continuous funding for immunization programs, because if we can achieve better funding, then we can achieve hopefully better uptake. Next slide, please. And yeah, so from our conversations with experts, we can see that there are many benefits to vaccination, especially if we take a life course approach. And there needs to be more cohesion on vaccination policies, programs, and schedules, like we have seen across the EU with COVID-19. That 80% uptake, especially in Western European countries, has been achieved through good cohesion and solid policy from the EU. And we can only continue in this vein if we continue to take a life course approach to immunization. And this is a really great quote from Professor David Salisbury from Chatham House, who said, the lessons of the benefits from coronavirus vaccination need to apply to other vaccines too. Vaccines save lives. And as Marius pointed out at the start of this discussion today, 20 million people or 20 million lives have been saved by COVID-19 vaccination. And in Europe alone, ECDC data with the WHO Europe suggests that nearly 500,000 adults over the age of 60 have been saved through COVID-19 vaccination. So this is really, really imperative. And we shouldn't stop here. We shouldn't stop at COVID-19. We should continue in this vein for other routine immunizations for flu, pneumococcal, shingles, to name just a few. Next slide, please. Okay, so just to wrap up, what do we recommend? So we make 6 recommendations in our COVID and beyond report. The first one is to spend more on prevention. As I've highlighted there, if we invest in prevention today, we can produce good outcomes for tomorrow. For every €1 invested in immunization in over 50s, governments can yield €4 back. So, there is a real case to invest in prevention, especially in immunization, to protect the health and well-being of citizens, but also to ensure that those citizens are more proactive in the wider economy, in work, in volunteering, and that's especially true for older adult populations. So spending more on prevention, it should be a key aim of Europe. Secondly, we need to harness technology to manage vaccination. Why is it that we had to wait until a pandemic to start to use digital platforms to manage and book to book vaccinations? We can see this with the COVID pass, things like the pass sanitaire used throughout the EU, or where I'm from in the UK, the NHS pass. We were able to book my vaccination through using an application and show my proof of vaccination through an application. This shouldn't stop at COVID-19. Again, we should be using these apps and this technology for other vaccinations, to book your seasonal flu jab, if you're over 65 to book your pneumococcal jab, or if you're at risk, to book your shingles jab. It shouldn't stop at COVID-19. So we should be harnessing this technology and continuing with this beyond the pandemic. Thirdly, we need to widen access to vaccination. Again, COVID-19 has demonstrated that vaccination can be performed anywhere by anyone within the right means, in the community settings, in pharmacies. In England, 99% of vaccination centres were within a 10-mile radius, and over 3,000 places were used to distribute the COVID-19 vaccination. Again, if we have this infrastructure and this desire to vaccinate people on a mass scale in these settings, we should continue to widen access, particularly in the community, to reach those hard to reach groups, to provide vaccinations to all those who need it and who want it in a setting that works for them. Fourthly, we believe that vaccination should be free at the points of use. We know that from previous influenza seasons, I think it was the 2017-2018 influenza season, around 10% of European countries charged people who are at risk for flu vaccination, which we believe is a barrier. Charging people to get a vaccination is something that could potentially be harmful for people from lower socioeconomic backgrounds. We know that COVID-19 vaccination has been free on the whole, and this has worked. If people have been willing to take it, knowing that it is free and that they can get it easily. Fifth point here is strengthening communication. We've heard today, and I've mentioned it, about fake news, about disinformation. We really need to, capitalize on good communication and make sure that communication is strong and effective. And Martin made a good point at signposting to the EU's communication and tools on and information on vaccination. And I think signposting to the right areas and ensuring that people who are more hesitant can read and get the right information on vaccination is really important. And finally, obviously, I'm going to say take a life course approach because we are a life course immunization charity, but this is really fundamental. Vaccination is not just for children. Vaccination is for all people throughout every stage of life, and this is really, really important. So yeah, that's everything I have to say. Like I said, I can't join for the Q&A later, but for more information, please do email me at research@cl-ci.org, and I will post these slides in the chat and can email them and post links to the reports that we published recently. Thank you very much.
Thank you so much, Patrick, for your presentation. Indeed, the vaccination is not just for the kids; it's actually for everybody. And this life course approach, when it comes to vaccination, should be one of our priorities. COVID-19 show us, so at least the case for the flu, and I think as well for other, looking to the clinical studies that will come in the next years, will be the case for other viruses, other diseases that affect the adults. And we should be able to frame that conversation starting from the COVID-19 lessons and to extend them to other types of vaccines and vaccinations. So thank you once again for being with us, Patrick. And now, thank you for your patience, Alfonso. Yeah, it's time to introduce you, Alfonso Moreira. It's actually public health expert, but one of the champions. He is working at the Portuguese National Health Institute. We know that Portugal was and still is one of the countries with the highest vaccination rate for COVID. And Alfonso will discuss about the Portuguese COVID-19 vaccination campaign and the role of conspiracy theories. So Alfonso, the floor is yours. Thank you once again.
Thank you, Marius. I will be sharing my screen since I have some slides to share with you.
Yeah.
So just confirm that you can see the slides.
Yes, we can see your slides.
Perfect. So then I will begin. Just like I said, thank you. Good morning to you and to all the attending this webinar. And on behalf of our National Health Institute, I thank the Rethink Health team and Inomed for the kind invitation to join in and to share our Portuguese experience regarding vaccination against COVID-19. I will start by presenting some data on vaccination coverage in Portugal. Then I will share some key aspects of our vaccination campaign and why we feel it was a successful endeavor. After I will share some of the research we've been conducting on vaccine hesitancy and its relation with conspiracy theories. So firstly, before I begin, I have a small statement to make. Though I'm currently working at the Directorate General of Health, I will be talking in representation of INSA, the National Health Institute in Portugal, where I collaborate in research projects. Also, I have no links to pharmaceutical companies or any related businesses whatsoever. So according to the most recent data published by the CDC COVID-19 country overview reports, Portugal is the EU country with the highest cumulative uptake for one vaccine dose and also for the full primary course of vaccination. And in terms of taking a first booster, I think only 3 countries are a bit better off: Italy, Malta, and Iceland. If we look at the stratified data, almost the entirety of the elderly population is vaccinated with either a booster or an additional dose. And in regards to the velocity of this vaccination, I can say that by April 2021, 85% of the population with 80 years old or older were vaccinated with the first dose. And by September 2021, 85% of the general population had its first dose. So the vaccination campaign was run by a vaccination task force, which developed and implemented a public vaccination plan. This plan had a clear set of objectives, of which I would highlight generating confidence among the population to guarantee vaccine adherence, improving the population's health literacy regarding vaccination, and fighting disinformation, fake news, and anti-vax movements. Some of the strategies that were adopted and that contributed to what we think was a success of this plan were prioritizing vulnerable groups and essential workers with vaccination by phases, which was common in many other countries. A strong focus on communication with the general population through regular, transparent, and trustworthy information. And I should say there was no ambiguity and political polarization about it. Every political party represented in our parliament said vaccines work, go get your shot, and that was a major factor. Also, there was a clear governance model with a task force responsible for operational management, and this was military-led team with expertise in logistics and strong capacities in working in uncertain environments, while the technical guidance was the responsibility of the Director General of Health, and INSA monitored the vaccine effectiveness. Digital health was also particularly developed during the pandemic, with it being used to facilitate, for example, the registration of individuals in the vaccination centers. I should say, I think there is no magic formula, but from our experience, we would summarize the main factors for this success were clear leadership, organized logistics, and I stress this, the pragmatic and thought out communication strategy that transmitted a sense of urgency and fighting spirit to the epidemic moment. And I think that was a main element of the campaign. There is another factor missing, which we actually consider a massive background factor in this story, and that's the pro-vaccination culture that has been built in Portugal over the last decades. So we have a national vaccination program, and this program was implemented in 1965 and has been running continuously since then. Despite it being centrally coordinated, it is decentralized, which means it is managed and implemented by regional and local health services. Right from the start, this program was built on principles of universality, accessibility, equitability, and it made it widely popular amongst the population, which has experienced how big vaccination campaigns have contributed to the elimination of various infectious diseases, such as poliomyelitis and measles. And this program monitors vaccination coverage from different cohorts and pathogens, and we have fortunately been able to keep coverage levels above the recommended thresholds as shown by this figure. Coming back to COVID-19, it is important to note that actually COVID-19 vaccine hesitancy in Portugal was relatively high in the beginning, with 56% that said that would wait to get the vaccine and 9% refused to get the vaccine on a survey that was conducted from October 2020 to January 2021, so almost 2 weeks after the beginning of the campaign of vaccination. And this study conducted at INSA, we identified some of the factors associated with the vaccine refusal or delay, namely being younger, loss of income during the pandemic, low confidence in the vaccine and health service response, perception of the official information as inconsistent and contradictory, and answering the questionnaire before the release of information about safety and efficacy of the vaccines, which might show the acceptability of this information by the public. We also noticed that conspiracy theories, which have been shown to contribute to this loss of confidence in government institutions and vaccination, were gaining some ground, especially on social media, where some groups started to organize and to disseminate misinformation about vaccines, the origin of COVID, and other conspiracy theories, which were also spreading around the globe. So these movements, these digital movements, ended up translating into the actual physical world. So this picture shows a memorable episode of the pandemic when the coordinator of the task force, of the vaccination task force, met a group of anti-vaxxers who called him an assassin while entering the vaccination center. And he famously said that denialism and obscurantism are the real assassins. This situation led to the need to increase security for his team and for other health decision makers. But so at INSA, we understood that this issue of growing conspiracy theories as a global phenomenon had potential implications on our collective efforts to guarantee high vaccination coverages and also in other wider social implications. So with this in mind, we have been conducting some research on the matter. This study that I'm speaking now, last week we conducted this cross-sectional observational study focused on studying the association between conspiracy beliefs and behaviors and attitudes towards vaccination against COVID. We had a residential Portuguese households as our study population, and we sampled the representative sample of the Portuguese population of around 1,500 individuals, adult individuals, and then conducted online and telephone interviews during the summer of 2021 using this ECHOS questionnaire. This is an instrument that is applied 3 times a year to a panel of individuals with questions regarding different health issues. In this specific study, we asked about vaccine beliefs and behaviors, behaviors and attitudes, such as intent to take the vaccine hesitancy, or vaccine refusal, and then applied a relatively recent scale to measure conspiracy ideation regarding vaccines. And then we analyzed the data. So this scale, in short, it was developed in 2016 to measure the individual tendency to adhere to conspirational ideation, specifically related to vaccination, and has 7 items. Each item gives a partial score from 1 to 7. And when we add up the item scores, we get a final score between 7 and 49. And higher the score, the higher the conspiracy ideation. And this was the first use of this scale in Portugal. So looking at the results, firstly, we observed that vaccine refusal had a low expression in Portugal. Adherence to vaccination was high, 95%. And then the proportion of individuals that express vaccine hesitancy, even though it's 20% and some other places might be really higher, we considered it is not negligible. And secondly, we compared the scores on the conspiracy belief scale between different groups. So, for example, we observed that people that intended to take the vaccine or that adhered to it had lower scores than those who didn't, meaning that higher conspiracy beliefs were associated with less adherence to vaccination. Also, when we conducted a multivariate analysis, taking in account social demographic factors, the difference in average scores on the scale was also significantly different for vaccine hesitancy. So the main conclusion of this work was that conspiracy ideation regarding vaccines was shown to have an influence on attitudes and behaviors towards vaccination in our particular Portuguese context, using this vaccine conspiracy belief scale, which highlights the importance to fight misinformation and conspiracy theories. So in conclusion, I would say that Portugal achieved high COVID-19 vaccination coverage, but is in line with other vaccines from the national vaccination program. So this underscores the importance of building that pro-vaccine culture I was talking about. Then I would say that the measures we used in the COVID-19 vaccination campaign focused mainly on transparent and regular communication, leadership, and organized logistics that enable to promote this adherence and accessibility of the population to vaccination, and that seems to be a good and effective model. Still, conspiracy ideation regarding vaccines influences attitudes and behaviors towards vaccination, and there is a need to strengthen the study of this phenomenon with adequate tools and fight it in a coordinated manner. It is also important to monitor and understand the characteristics in a cross-cultural manner to develop efficient strategies. So we need to look at these issues, especially conspiracy theories, in an European and global perspective. Finally, it is crucial to build confidence in the vaccines and for the population to see it as a fundamental right. So to finish, I commend the efforts of the Eastern European Vaccination Task Force, and I hope we have contributed to the common goal, breaking the Iron Curtain of Vaccination. Thank you very much.
You definitely did, and thank you so much, Afonso, for your presentation. Indeed, you highlighted some very important points, and this idea of pro-vaccinated culture since 65, wow. I think was one of the keys for your success, but as well you mentioned the leadership and as well the political coherence. In other words, wasn't a politician in Portugal to be hesitant or against the vaccination, as we have seen the case in our region. And as well, the vaccination is a fundamental right. I think it's a key message to build on and to build this culture actually on this. And I personally enjoy your surveys, your study, and the way you actually adapt the communication campaign to the findings from these, I think 3 per year studies you did is something I have shown as a model at the beginning of the event. I think this is the right way to implement this personalized communication. It's not easy. It's not easy. It takes a lot of time and energy and budget and money. But looking now at Portugal, we can easily see the results. And one very short comment, I was really surprised to see actually that 55% of the population was at a certain moment hesitant, and 9% refused the vaccination initially. So 65% was quite the same percentage in our country at the same moment. So it's very, very important to highlight this. So thank you so much, Afonso, once again for your contribution. Thank you so much. Now we are moving to a presentation before starting the conversation with 5 leaders from the region. But first, I would like to invite an industry representative, Laurent Louet. He's Director of Public Affairs and Country Liaison at Vaccines Europe, to present us the industry perspective on using innovation for tackling infectious diseases. So,
thank you, Marius. I hope you can all see me and hear me well.
Yeah.
Okay, excellent. Thank you again for the invitation today. I think it's a really an honor to be here with us, with you and with such esteemed colleagues. I think that we already seen quite exciting and very telling presentations from a previous speaker. So I see we are, I'm just before the Q&A and the panel. So I'll make quick points and then we can perhaps move to the discussions. But I think, first of all, a quick word on the Vaccines Europe. We are a trade association based in Brussels. We represent vaccine innovative companies in Europe. So our members are the major global companies, but also the smaller and medium-sized companies developing vaccines in Europe. To reflect a little bit on what has been said today, and I think that we can all agree that definitely vaccination is a key public health tool, one of the most cost-effective prevention measure we have at our disposal, which also provide undervalued benefit to the society and the economy. I think that we are now hopefully at the tail of the COVID-19 pandemic, but I think that we can already learn some lessons from that. And it really revealed what a virus can do to our daily lives and economies. And also it also showed how the value of vaccination as well, including for adults. And that's a little bit of what I also want to say here today. I think that we've seen throughout the COVID-19 crisis that indeed the immunization programs across Europe, they do confer a strong protection across the, against COVID, but also across the life course. So be it pediatric, adolescent, or adults. But there is still significant difference in the access, but also in the implementation of those programs across the region, and notably, of course, East-West, which is the reason we are here today to discuss this, those inequalities. We ran a study recently on the if you want the offer that is made to the public in Europe, and if you look at the number of vaccines that are publicly funded and offered to the population across the region in the 27 member states. I think that our study showed that, and it's also based on ECDC figures, that in Romania you have only 8 publicly funded vaccines available to the population, while if you compare to Greece or Italy, where there is 17 vaccines publicly available and funded by the government. I think it also really tells a little bit how those programs are differently implemented in countries. And that leads to a crucial point, as we all know, it's the financing, how countries finance their immunization programs. Despite immunization being highly cost effective, and it was also already shown a bit before by Patrick, most of the government, most of the EU member states do actually limit the funding capacities. I mean, we less than 0.5% of the healthcare budget, which is less than €5 per capita. If you look at again at Romania, it's from 2019 data we have, it's nearly approaching the €3.68 per capita. So it's really low, or especially if you compare to the benefit for the society, of course. And I think that, if we want to improve the situation, if we want to assess the situation, we need definitely to have also a very strict timely monitoring. I think that, again, COVID-19 really turned the spotlight on the differences in the vaccination uptake between East and West. If you compare, again, Romania coverage rates with Portugal, I think that it is, again, quite telling. We just saw with Alfonso. But it also tells that basically the issue was not supply for COVID-19. I mean, the doses were there, but the issue was the ability of countries to implement an adult immunization program, because this is in the end what it is. COVID is an adult immunization program, and there was clearly a lack of infrastructure, and that's not only for Romania, but for most of the countries in Europe. There was also a lack of training from healthcare professionals, at the many different levels, but also, again, to echo what has been said earlier, a lack of convenient access to support those programs. I mean, we know that it's probably easier to have pediatric programs because indeed you bring your kid to the pediatrician, or you have indeed also school programs. But for adults, you need to have really convenient access with strong local communities, with a strong support from local healthcare professionals like pharmacists or GPs. So that's also what is, I think, lacking as well. That could really play a role. And then, of course, as a final point, as we all know it, the vaccine hesitancy and the lack of trust. I think that it is also an issue. We should not hide from it. It does play a role from the citizenship, but also from the politicians as well. And again, here I see it. So we have definitely solutions, like it was also presented by Patrick and Alfonso, to combat this hesitancy. But I think it also takes time, right? It's not, you will not change the people's mindset in a minute. You need time. You need also to invest as well, human resources as well in that regard. So I think, just to finish here, and the course we as Vaccines Europe would like to make is that right now vaccination is not for pediatrics anymore, not only anymore. I mean, it is important to have really strong support for vaccination programs across the life course, because this is exactly how we will protect the entire population. We need, of course, data. Data is key. We need registries. We need timely monitoring of coverage rate. We need for that as well, of course, member states working together and also with the ECDC to assess the performance of those immunization programs and to implement timely public health measures. Again, a call on vaccine hesitancy. We need more convenient access. We need more work with the local communities and also with the healthcare professionals as well. And finally, funding as well. It is critical. It is a key public health tool, immunization, and that must be supported with appropriate funding. And we need also sustainable funding, not just a one-off, but really on a long term, for those programs to be self-sufficient, self-sustainable, and then to have really a strong and solid protection for the population. So that's a little bit our points for today, and very happy to discuss again with you. And again, I want to really tip my hat to you for this coalition and for this event today. I think it's really important to bring this topic with those countries, and I'm really happy to be part of this discussion. So thank you.
Thank you so much, Laurent. Just to add that this Eastern European Task Force is actually open. We are just, let's say, the nucleus of this is open for any institution, any individual who is willing to join us and to work in this field. And you mentioned the hesitancy. Of course, we cannot change it overnight. We should invest in this. And the investment was as well highlighted, I think, by Patrick earlier today. It's very important to have a long-term plan when it comes to vaccination. Alfonso showed us, I think, the best example, starting 65, building a culture. This is the key, but is not the or could not be an overnight build reality. So thank you all, and we have some questions. I will address them immediately. But now it's time to listen some people from the region, and I'm very happy to introduce our panelists for the second part of our discussion. And I will start with Svetlana Nicolescu, who is Secretary of State and Minister of Health in Moldova. Svetlana, thank you so much for being with us today. And as well, Amina Kosaric joining us from Bosnia and Herzegovina. Thank you so much, Amina, as well. Victor Dombradi from Semmelweis University from Hungary. I cannot wait to listen your explanation, because Hungary is a bit higher than the rest of the countries in the region in terms of vaccination rate. And we hope to have with us as well Victor Semenov from Ukraine. I know that you, Victor, in this morning you face a situation related to the war. I hope you can hear us. And as a part of this task force are our colleagues from Plovdiv University. We are waiting for them also to join us. But I will start with you, Svetlana, and actually the question for you all is, how do you actually explain these differences between our region and the West?
Hello, dear colleagues. Marius, thank you. Indeed, thank you for inviting Moldova to be part of this discussion and to participate in this event. To Moldova, similarly as to other countries, COVID vaccination remains one of the priority topics on our public health agenda, including because unfortunately we have not been such successful as the other countries, specifically Portugal, that we have already talked about. And I will share with you some of our perspectives, how we address this issue, and hopefully together in our regional discussion we will be able to identify some additional solutions. So I will start with saying that indeed we focus today our discussion on vaccine hesitancy and vaccine demand, but some of the countries in our region, specifically when we're talking about this Western-Eastern divide, at the very beginning, we were struggling a lot with vaccine supply as well. And here you, from the beginning, you need to have a right balance between vaccine supply and vaccine demand. It was about having vaccine in the country, finding the funding, sustainable funding for vaccination campaign. I'm happy and very grateful to say that Moldova was the first country from the European region to receive vaccine against COVID through COVAX initiative. And along the way, during the implementation of the vaccination campaign, Moldova as country benefited a lot, both through COVAX initiative, but also through some EU member states, the bilateral partnerships and donations. And here we come to the second issue. Having available vaccine does not mean that you have a vaccinated population. And there is a need for a lot of efforts from public health sector, from the whole society in attempts to address the vaccine hesitancy. And I will repeat some of the issues, but just because they are very important to us and they influenced our situation, some of them were already addressed, but they are absolutely relevant to Moldova as well. Well, first of all, the political side of vaccination and COVID in general. And in Moldova, the COVID and measures to address it, including vaccination, had become heavily politicized. So we had this divide, a lot of messages coming from politicians, not favoring vaccination, a lot of ambiguity, and from the very beginning, it compromised the vaccination campaign. And at that stage, Moldova was at the phase of political instability. We didn't have the government in place. So it was a lot of negative influence from the politician side, let's say, on the successful start of the campaign. The second, another very important aspect, which relates not only to COVID vaccination, but to routine immunization campaign as well, is the role of the health workers. And we have this data, we have this evidence from several national surveys we have conducted addressing the negative trend in routine immunization campaign even prior to COVID pandemic, where actually the health workers' role and the way they communicate with families, with parents, the level of trust the population have in healthcare workers actually is a very significant determinant of the outcome of our immunization campaign. And it was even more important, become even more important for COVID vaccination. So first we have to build the trust among healthcare workers who afterwards to become the good messages and driver of vaccine uptake in population. Today, the vaccination coverage among healthcare workers in Moldova is around 98%, but from the very beginning, again, it was an issue to be addressed. And another critical aspect, again, applying not only to COVID vaccination, but to routine immunization campaign as well, is looking and tackling immunization not solely as a medical issue, but really as a public health issue. And when we talk about immunization, it's not about only the healthcare workers. It's about involving communities, engaging this cross-sectorial focus and cross-sectorial approach to be applied to immunization. And this is exactly what we continue to do together with our partners. And actually, currently, we're at the stage of implementing community, local communication campaign, immunization campaign in the regions that were mostly impacted, negatively impacted by COVID pandemic in terms of declining of routine immunization coverage. So unfortunately, the trend we were registering during the last years with the decrease in routine vaccination coverage, during pandemic, it deepened. This trend fall down, and one of our goal the current goal is to regain this immunization coverage with our routine campaigns. We are also impacted by this army conflict in Ukraine, Moldova being one of the countries that receiving a great number of refugees, and we know that in Ukraine all immunization campaigns stopped. We know that Ukraine was the country that registered some polio cases. So there are a number of additional risks that Moldova is trying to address through our current activities. And just to reflect a bit on one of the comments that was in the chat on the way and the opportunities to engage the priest and the church in the campaign. When I talk about this cross-sectorial and intersectorial approach and community activities, the church is one of the actors, let's say, that our approach is trying to engage, and some of the regions are successful in doing this. And just to share, since it was a question about sharing some of the messages that could come from them to influence, to positively influence the decision in vaccination. One of our priests that our public health workers are cooperating with, he talks in a very simple language, addressing those who come to his church, saying that when you ask the God to have a good harvest, you don't pray for the good harvest. You pray to having rain, you pray to having good weather, knowing that this will give you a good harvest. Similarly, the health is one of the greatest things we all want to our kids, to our families. This is something that we pray for, but it doesn't come from the God. The God send you good health workers, knowledgeable. The God send you good vaccines. I mean, they find the way to use the same language for their communities, and we are trying to have this engagement from their side. Now, to summarize the three key points that we think that they can influence both in a negative and a positive way, but we need to address them. It's political solidarity, or avoiding any negative political engagement in vaccination campaign. It's trustful and knowledgeable and healthcare workers that are confident to speak to their patients and we need to build these capacities in them. And finally, applying this intersectoral or cross-sectoral focus to vaccine campaign, it's something that we will try to work along in order to reach the targets that all the region has beyond us. Thank you again so much for inviting.
Thank you so much, Svetlana, for highlighting the situation in Moldova. It wasn't easy because not being yet a part of the EU, the vaccination campaign actually delayed compared to the EU countries. And now with the situation and the migrants from Ukraine, the challenges are even higher. But I think these political determinants of health are a point actually touched by each of us today, how important it is to have this common language, and as well the trust and knowledge of healthcare professionals. I'll refer a bit later to one of the questions from the chat. And this cross-sectorial approach, and I was very happy to listen, how to engage with the religious leaders. In Romania, there were a lot of meetings before starting the vaccination campaign, virtually with all the religious leaders. I know this very well, and in a way or another, they have supported the vaccination campaign. And in the months to come will be published, I think, a very interesting paper showing that there is no connection between a certain religion and the willingness of a person to accept the COVID-19 vaccination. So thank you so much, Svetlana, for pointing all these things together. And now we are moving to Amina Kozaric. He's professor at the International Bar University Faculty of Engineering and Natural Sciences, Department of Genetics and Bioengineering in Bosnia and Herzegovina. Amina, now the floor is yours. The same question.
Thank you very much. Thank you very much for the invitation to talk to the panel today. It was very interesting to listen to all the speakers and to compare the experience in Bosnia to the countries that are relatively similar, like Moldova, and to also other countries that are in the EU, and to look at the similarities and differences of our experience through the COVID pandemic and the vaccination rates and hesitancies and different aspects of the society that have influenced the rates of vaccination. So there are several points I would also like to address regarding Bosnia and the vaccination. So similar to, we've had a relatively similar experience to Moldova, where the vaccination has started relatively late compared to the EU countries, and the first vaccines that came to Bosnia were some small donations from neighboring countries and European countries and through the COVAX system. The larger vaccination started in December of 2021, and for the general population. And when we look at the rate of vaccination, there are about 25-26% of the population have been vaccinated, which is one of the lowest in Europe. We have conducted a survey before the vaccines have arrived at the end of January, where we asked more than 10,000 people regarding the hesitancy towards vaccines. And what we found was actually a very similar percentage, that about 25-26% of the population were willing to vaccinate, while 75% of the population were hesitant or would reject the vaccine. And interestingly, the same percentage was actually found later on with the actual percentage of the population that has been vaccinated. So, so what's the reason for such a low vaccination in Bosnia? Also, just to mention that we have one of the highest rates of COVID deaths in the world. So what are the reasons for this? So there are several of them, and again, echoing what Svetlana has said, there are several of them, and I'll go through it in a similar fashion that Svetlana has done. So the first one is the political situation. So we have quite a volatile political situation, and the organization of the country is quite complex. So both of those issues have contributed to the distribution of the vaccine, but as well as the mistrust of the population towards the vaccination. So there has been some political affairs during the pandemic that have, I think, slightly influenced the way people think about how the vaccination, the whole process. So and the healthcare system is connected with the political system, and the way that I think the public has viewed it is that it has slightly increased their mistrust in how whether they would get vaccinated or not. So again, the political volatility plus the complexities of how the country is organized have contributed to different to lower vaccination rates. Another, just to talk about how the vaccination process has developed in Bosnia. So the first, through the COVAX mechanism, the healthcare workers were vaccinated, and then the more vulnerable populations were then vaccinated through the in the summer. However, there was an interesting phenomenon at the time in the spring, because the neighboring countries have already received much larger doses of the vaccine, like Serbia and Croatia. Serbia in particular were quite, they had much larger numbers of vaccines than Bosnia has. And what has happened is that those people who wanted to get vaccinated actually traveled to Serbia. It's not that far, a couple of hours at most from some of the regions. So those who wanted to get vaccinated actually sat in their cars, and companies organized buses to take them to Serbia. And Serbia was quite open and said whoever wants to come can come, no questions asked. So those who wanted to get vaccinated actually just went ahead and got vaccinated in the spring and early summer of 2021. And those who couldn't actually, who were maybe older and didn't have the means to travel, that they got vaccinated through the program in the summer. So we did not have there was no government-led program in the whole country, because the country is divided into two parts. Each one did their program separately, but it was relatively about the same. So there weren't such big differences between the vaccination campaigns in those in Republika Srpska and the Federation of Bosnia. So that's both regarding the political and kind of what actually happened on the ground in those months when the vaccination campaigns have started. So despite, so what was, one of the conclusions is those who really wanted to get vaccinated found a way to get vaccinated. Those who were hesitant either waited for the general public, or didn't get vaccinated, or if they were coerced through work, or if they had to travel and so on, they would get vaccinated. So regarding the second point that Svetlana has raised is the level of mistrust in the healthcare workers. I would say in Bosnia it's more general mistrust, not in the workers per se, but in the healthcare system that both has had issues with corruption in the past and the actual organization. So I think there has been a bit of a mistrust in the healthcare system as well that has contributed to the vaccination rates. The third point are the conspiracy theories, and it was quite interesting to me to compare the Portugal rates, which seem relatively high, very similar to our rates. So it was 55% right? And the 6% of hesitancy, rejection and 55 hesitancy, which we found in our survey to be slightly higher, but again, not the difference is not as much as I would have expected. So which raises the point of the importance of the organized system and approach to the vaccination, which we did not have at all, right? The level of hesitancy here, so there, let's say it was 61%, here it was 75%. So it's not as that big of a gap as I would have imagined. But conspiracy theories have definitely played quite a large role in how people look and understand, have understood the pandemic and the role of vaccination. So the social media and the widespread conspiracy theories have, I think, been one of the major factors in Bosnia that have created doubt in people's minds whether vaccination is something that they should do. Plus, if you layer on top of that the political system mistrust in the actual institutions, I think those are kind of the two main factors that people have that were there that led to such a low vaccination rate in Bosnia. So those are kind of the points that I have echoed as Svetlana has gone through, because I think we have relatively similar experiences here in Bosnia. So I think there's so much work to be done here in order to increase the awareness and trust in the vaccination of COVID, as well as other vaccines as well. I mean, one of the interesting points is that someone has raised is regarding the mandatory vaccines, for example, childhood vaccines. We have seen just before the pandemic slight decrease in the rates of the childhood vaccinations. And I think it will be quite interesting to look at how those rates have possibly changed due to all of this experience that people have had with the COVID pandemic. Thank you very much.
Thank you so much, Mina. Quite the same challenges facing by you and the people in Bosnia, as well highlighted by Svetlana in Moldova. Quite the same challenges here in Romania. And now I would prefer to stay a bit outside the EU and to invite Victor Semenov from Ukraine. Victor is a family medicine doctor and teaching assistant at Department of Social Medicine and Public Health at Dnipro State University, Medical University in Ukraine. And then I will invite the other Victor from Hungary to explain why the vaccination rate in Hungary is actually higher than the rate in the other countries in the region. But first, Victor from Ukraine, thank you so much for joining us. I know that is not easy for you to do it. So yeah, the floor is yours.
Thank you very much. Hello, everybody. Thank you for invitation to this conference. Thank you for wonderful presentations today. Yes, I might experience some technical issues because today morning here in Dnipro started for us from the explosions, unfortunately. So now I have to broadcast from the shelter. Starting from the question about the vaccine rate in Ukraine, which is for the February 24th was 36% in Ukraine, and it is not very high. I would say that in the first order, this number is related to the general hesitancy to vaccinate in Ukraine. And I would say that the reasons for this hesitancy are quite the same as for majority of Eastern European countries. General mistrust to vaccination, to healthcare workers, which stems from different reasons. I would say that the first reason for this mistrust is the low contact of the population with the healthcare workers, with the family doctors at first order, which was quite an issue till recent times when the reform of healthcare system was launched. I believe that the situation improves in the last 5 years. And this led to the situation when the population, when they have questions about, for example, vaccine, they would refer not to a family doctor, but to somebody else, for example, social media or their relatives. And here in Ukraine, I guess, as so much as elsewhere, anti-vaccination groups are very active. And they help to create the image of vaccines as of something dangerous and of something which risks way overweight the benefits of vaccination. So people believe that, tend to believe usually that the vaccines are rather dangerous thing than beneficial. And also here in Ukraine, we have a situation which also contributes to this low rate of general vaccination, not only COVID vaccination, is the contradictions in legislation. We have two equally powerful laws, one of which states that vaccination is mandatory, and the second one claims that everybody is free to decide whether or not a person will accept treatment or preventative procedure when deciding whether or not a patient is going to receive the vaccination. And given that the image of vaccination is rather negative, people, when they can, tend to decide not to get vaccinated. And I think that this is the main issue. So in order to improve this rate of vaccination, we need to kind of to work with the social perception of vaccination in the society. And we also have another issue in Ukraine, which is quite similar to the point that Amina highlighted, is the political influence. For example, despite the COVID vaccination in Ukraine started rather early, the first doses were delivered to Ukraine at the end of December of 2021. We still have a situation with the general hesitancy of COVID vaccination. And it's partially related to the situation when different politics, which were responsible for procurement of different vaccines, I mean, vaccines produced by different manufacturers, tried to convince the electorate that this vaccine is better than the vaccine procured by their opponents. Yeah, for example, those people who were responsible for delivery of AstraZeneca vaccine, they claimed that this vaccine is the best, and they were attacked by their opponents who pushed for the procurement of Moderna or Pfizer vaccine. And it's natural that part of the electorate try to follow their political leaders and to deny the vaccines by some provided by some manufacturers in favor of other manufacturers. So this might be an issue for Ukraine.
Thank you. Thank you so much, Victor. And first of all, thank you for joining us. I know that, of course, you have other priorities currently in Ukraine, especially in this context of the war. But we really appreciate your involvement in our today webinar and to share with us all these Ukrainian realities. The last example, the divide around both vaccines and political party, I think it's an incredible example on what should be avoided no matter the price for this. And yes, this discussion pro and cons for the vaccination was promoted as well in many countries, as well by televisions, was endorsed by some politicians, of course. And this, I think, was one of the reasons for people to become hesitant or against, but because they actually didn't become against the vaccine, but against the political opponent. So this is very, very interesting and very important to to understand in order to restart the vaccination. And as I said, now we go to the good example, I think, from Central Eastern Europe, who is Hungary. Very happy to have you, Victor Dombradi, with us. Victor is senior lecturer at Semmelweis University Health Services Management Training Center in Hungary. Thank you once again. The floor is yours, Victor.
Thank you very much, and thank you for inviting me. I would like to address the question at two levels. First, at the European level, may I share my screen? Is it possible? Let me try it. Yes, does everybody see this map?
Yeah.
So I was doing a little bit of research for today, and this is the World Health Organization's map, and we have already seen some graphs and maps about fully vaccinated countries. And this is a map about the boosters or additional doses per 100 population. And if we focus on Europe, then you can like clearly see this east-west divide. It's like a historical map or an economic map. And this is like really fascinating, but also it's a little bit of a sad story. So there's two main issues or story behind this. I think first and foremost, it seems that there's like a cultural determinism. So basically, we Eastern Europeans are still victims of our past, and this is something that we need to work on. But on the other hand, there's also like a little bit of deviations. For example, if we focus on Western countries, we can see, as already mentioned, that Portugal is exceptionally good. Iceland has good numbers of booster vaccinations. And if we focus on Eastern Europe, then of course, you can see that although none of the countries is green, but if we focus on the Czech Republic or Hungary, then the numbers are very close to the threshold where it could be a little bit more greener. So I think the key message here that although there is a little bit of determinism here, good policy matters. So if we implement good policies, then we can make a little bit of difference, although it depends on what we do. And unfortunately, it seems the culture also determines what kind of ratio we can achieve. So you can see that Hungary is, you can see, is among the first of the last groups. So unfortunately, we are better in Eastern Europe, but as you can see on the map, that unfortunately, we are still not as good as Western countries. And of course, the question is that compared to other Eastern European countries, why is it that Hungary has much better vaccination ratio? And I think the good news is that our political environment is much more suitable. For example, the government currently in power was immediately very proactive when it was the issue about vaccination. So immediately they created a committee, they issued and addressed questions with experts. And also the opposition left was also pro-vaccine. So basically only the far right was against vaccination. So that can be one of the key factors why Hungary has a very good vaccination rate regarding COVID-19. But also the Hungarian government take proactive actions, like, for example, communication campaigns. You could go to the streets and there were like posters everywhere to take the vaccines. Even the head of the Semmelweis University was on the posters, and you can actually see that there was like a slogan that vaccines work, Hungary works, something like that. And this is like very important, that it seems that if the government listens to experts and takes proactive action through communications, campaigns, media, then you can gradually increase the vaccination rate. Also, I hope you can see it. This is like a card I received when I get my vaccination. It was posted to my home very early. You can see that it was even a QR code. So basically this card made it possible. There were like plans that in restaurants, if you had this, then you don't need to wear a mask. Or for example, you can go to soccer games. And basically, again, this is a very good incentive that although it's a little bit intrusion into the personal liberty of the individual, but again, this is like a good way to actually make sure that the citizens are incentivized to get the vaccination. And also there were like many other steps. For example, there are like vaccine buses that were organized into areas where there were, for example, they were a little bit separated from main cities, and the distribution of vaccination was a little bit challenging, especially in the early phases when it was, only the mRNA vaccines available, and they required special cooling, I believe. So that was a little bit of challenge, that how we can distribute it. Later, we found out that, it's not the strict rule that we need to follow, but then again, that was a little bit of challenge. But vaccine buses was a very good solution for this. And also highlight that how committed the Hungarian government was to vaccination. We were among the first countries to also accept the Russian Sputnik and the Chinese Sinopharm vaccines. And of course, there was a little bit of backlash at the European level that, can it be accepted? Because, for example, I think one of the key incentives was for vaccination is to travel between European countries. And it was a very serious question that if somebody got the Sputnik or the Sinopharm, then, for example, many cases, it was not permitted to go to Austria, neighboring country. So there are many, many factors that contributed. I think Hungary was very lucky. Again, the Hungarian government was very proactive, pro-vaccine, listened to experts, invested heavily into communication, used various tactics. So I think, as the map showed, unfortunately, it wasn't enough. So again, there's a cultural determinism, but we can all ask the question, what would have happened if all the Eastern European countries did the same policy as the Hungarian government? How many more of the citizens would have been vaccinated, and how many people would have been saved? So I think if we summarize this, then this is the key message from Hungary. But again, if you have any questions, then please feel free to ask.
Thank you so much, Victor. Indeed, if you have questions for Victor, for Svetlana, for Amina, Afonso is still with us as well, Laurent, this is the right time to do it. There are as well some questions in the chat. I think we addressed the question related to examples on the best practice example on how to involve the religious leaders. I have in mind as well the Greece with a highly visibility involvement of the Orthodox Church in the vaccination campaign. I think we should add this to the answer. I already discussed about the Romania. And indeed, is this topic of HPV vaccination, and I think Simona raised this point on the chat. It's a question more related to the national situation currently. We are struggling to find the best way to restart the vaccination campaign. After the failure in 2008-2009 of the first HPV vaccination campaign, you have seen that the vaccination rate for HPV are below 5% in our country. So currently the vaccines cannot be buy from the pharmacies, but there is as well a problem with the access to the vaccines required by the patient, by the parents, to the family doctor. This is the way it works now. The parents should require the vaccine to the family doctors, and the family doctors then to public health institutions. There are some delays and I think some financial problems, I don't know. But it's something that should be addressed because, as I mentioned, this year, the European Commission established a joint action for HPV vaccination, part of the Beating Cancer Plan. And in the next 3 years, 23 to 25, will be some rounds of vaccinations for HPV in actually in all the EU countries. So I think I answer also this question. And thank you so much, Afonso, for asking the question regarding the full transparency. I fully agree your answer. I think this is one of the keys to be open, to be transparent, to not be afraid to put scientific data or scientific explanation in the public domain. And I have in mind an example with the blood clot for one of the vaccines. And I think that was the major crisis of the vaccination campaign, at least in our country, and was actually fed by the lack of transparency and hesitancy in the way the scientific arguments were put in the public domain at that moment. So this is my let's say additional comment. But let me check the chat. So okay, looks like we had a very good meeting today. Maybe you have some final question, comments, suggestions, or what you consider. If not, I will say just that it's just the beginning. This Eastern European Task Force on Vaccination is just the beginning of coagulating, of putting together different groups from the region around different topics. The vaccination is one of them. We'll follow others shortly, hopefully, and we'll continue to build this network. So will be very helpful to share this information with the people from the region, from your countries, that they can join us, and we can, because it's really important to start working together, because as Martin said, the winter will come anyway, and we should be prepared for this. And especially it's important to avoid the mistakes, and were highlighted a lot of them, some of them in relation with the politicians, other in relation with low involvement of the healthcare professional, and especially the nurses, and the lack of cross-sectorial approach when it comes to adult vaccination. So I would like to thank you so much for being with us today, for your contribution. Our colleagues from Center for Innovation in Medicine cover real time on Twitter and LinkedIn and Facebook the event, but a report will follow in a matter of days, and a follow-up. And yes, I wish you all a very nice summer and vacation, and hopefully we will see each other in September with other projects. So thank you so much and have a nice day.
Thank you, you too.
Thank you. Bye-bye.
Thank you.
Bye-bye.
Thank you.
Thank you very much. Yeah.
Thank you.